Well, good morning, everyone, and welcome to another live this morning. And hope you're having a great start to your day. And I hope you're getting your notifications. A lot of people say they're not, and that has nothing to do with me, but can be frustrating. Always go to the Martin Clinic on your Facebook. Go to Martin Clinic. If no notifications. Mike, Norland, Lori Lee, how are you? Sandy, Fergus Falls, Minnesota. And Mary from Norwich, good morning. Nick from our staff. And Sandy, Chilliwack, British Columbia. Rosalinda from the Kidneys of Canada. Niagara Falls, Jude from Troy, New York. Beverly, good morning. Fran. And Wendy from Markham. Jeanette from our staff. How are you? Heather. Miramichi. Bonnie. Louise, how are you? And Betty Lynn from Brantford. Sue, good morning to you. And Nancy, how are you? From Gore's Landing. And Vince, welcome to the program. Donna. And Jean. And Wanda. Good morning. Dave from Ridgeway. And April. And Cecilia. Shedjak. Nouveau Brunswick. Linda. Oh, those Lindas. Georgie. Halifax, Nova Scotia. Barbara from Nova Scotia. Adeline. Good morning to you. Karen. Okay, we appreciate it. Linda from St. Jude, Quebec. Brahim, holy moly. Yvonne, Petawawa. Wendy from Wasaga Beach. Brahim says I'm late. No kidding, you're usually at the top. Norma, Texas. And Nina from Chatham. Yalound, I've been waiting for you. Allison, Carstairs, Alberta. Lori, Cambridge. And Tina. And Johanna. How are you, Joanne? Douglas, St. Thomas. Sue, Manitoulin Island. Bonnie, London. Good morning. Bonnie from Annandale, Minnesota. Sherry from Dryden. Good morning. Janice from Brampton. Guys, Nativity. Wendy. Chantal, how are you? From Sudbury. Brahim with his coffee cups. I love teasing you, Brahim. And Barbara. Gertie, there she is from Burlington. Helga. Beverly from Newfoundland. Bertha, how are you? And Nellie saying good morning to everybody else. Dave, Wanda from Virginia. Couple of more guys. Let's get going. Rose Cavallari and Lisa and Bonnie from Little Britain. Okay. Let's just go over this. And Connie, how are you from Ohio? Donna from Newfoundland. And those Lindas, we love every one of those Lindas. Milika, she says I missed her. Edith, Beverly, guys, I often miss, but I don't mean to. Nancy and Sandy. Okay, and Susan from Cape Breton, and I hate to miss anyone. Cheryl. Okay, I gotta read to you a headline in an article that I looked at the other day. Americans pay more for health care but die sooner. It wasn't a positive article at all. And it was talking about the bang for the buck. Now listen, we're no different in Canada, okay, because this has been figured out before. In the United States, they're saying they're paying on average, okay, so you got 40 million people in the States? 10 times the population of Canada. And what they're saying in this article is the average American pays $11,000 per person for health care in the United States. And they're not getting the bang for the buck because in spite of spending all that money, they're not healthier. They die sooner comparatively to countries that spend a lot less. Okay? Now, we're no different in Canada. I think it was figured out probably 4 or 5 years ago when I read how much we pay as Canadians. We pay somewhere between $13,000 and $14,000 per person in Canada for health care. Okay? And at the end of the day, it's not health care. It's disease care. The amount of money spent on prevention is negligible compared to what we spend when people get sick. Now, one thing I do love about our healthcare system is the catastrophic coverage. Meaning, if you've been in a car accident, okay, I have a son-in-law who's an emergency physician. I call him 1-800-SAM. He's such a good doctor. If you get in a car accident or you get hit by a bus, don't call me. Okay? So our catastrophic care in Canada, United States, is, you have a heart attack, you want to get to a hospital as fast as you can. And that's 100% in agreement with that. Okay? But what we're talking about here is the amount of money we spend on so-called healthcare, and we're not getting the bang for the buck. The results are terrible. Okay? And this morning, it's not like you guys don't know this, but it's always good to go over. So here's me. Okay? Here's me. And I always ask the question, why? Why are we in such bad shape? Why are we spending so much money? Why? And why aren't we getting the results we should have for the amount of money we spend? Okay, I talk to you. We never talk about prevention. Okay? Rarely. I'll give you an example. The Cancer Society, okay? Canada, the United States, okay? Here's the Cancer Society. What do they say? Early detection. Early detection. Guys, I'm sorry. I'm not against early detection. I'm not. But that's not prevention. Detection's not prevention. In their minds, it is, because to them, early detection means you're getting at a cancer early enough, the chances of you living longer are better. Again, I don't disagree with that, but I don't want you to get cancer in the first place. Okay? As I point my finger out to you guys, I got 1, 2, 3 pointed back at me. Okay? So when I point at you and I say, I want you to prevent cancer, I talk to myself too. Okay? How do you prevent cancer? Well, cancer, first of all, is a complicated thing. But what we can do and what we can control, you can't control our environment. Okay? You can't live in a bubble. I don't expect you to. And even if you did, somehow toxins would get in there. Nah, come on. We got to live on the planet. It's the way it is. Okay? It's just the way it is. But I talk to you about taking care of you. Food, primarily. Sun, steak, and steel. And I mean it. Somebody asked me the other day if I was joking. I'm not joking. I mean it. Sun, steak, and steel. Food. Get strong. Get in the sun. Nothing better for you. Nothing better for you. Prevention. But why? Okay, so let's just go over this, okay? See my notepad? Number 1 on the top, and I put them 1 and 2, and they belong together, and they are often intermixed in terms of ownership. The biggest problem, why we're failing, why we're spending so much money, the biggest problem is what? Big pharma and big food. See that? Big pharma, big food. Conglomerates. Follow the money. Follow the money. And you know, look, I'm not saying there's no good people in big food and big pharma. They employ, millions of people. And look, I don't want to go after their people. I want to go after their motives. And they love status quo. And unfortunately, medicine, okay, because I have here on number 3, modern medicine. And modern medicine hasn't been taught prevention. They just haven't. It's not part of their education. It's very little of it. Well, as a matter of fact, I'll take you from cancer to heart disease. And since the late 60s, 1970s, I watched it happen. We've been on a fat craze and cholesterol craze. Okay? Big pharma, big food, and medicine. Modern medicine. That's all they really know about food. Oh, fat makes you fat. Fat is bad for your blood vessels. Cholesterol is the boogeyman. That's modern medicine. That's what they're taught. Still today, part of the curriculum of heart disease is telling young physicians, or soon-to-be physicians, that cholesterol is a big, big problem in heart disease. They still haven't got the memo. It's so pervasive. It's so pervasive in teaching, in indoctrination. I'm not even confident to change their minds. Right? It's part of everything. And when you consider, think about this for a minute. When you consider that the average medical doctor, God bless them, they've educated, they're smart. The average amount of time that they spend in nutrition is an hour and sometimes less. They just don't learn anything. And again, what they learn is fat is bad. Cholesterol. You get cholesterol in the animal kingdom, in eggs, meat, and cheese. So guess what they say? You better limit that. You got cholesterol. And cholesterol is the bad guy when it comes to heart disease. So they get no training in nutrition. So do you think they think food is important? You would think. Any physician would think, well, what I put in my mouth is pretty important. Nah, they really are not taught that. So they hand it off to a profession called the dietitians. And unfortunately, dietitians are into moderation, calories, eating lean, and they're really big on the plant kingdom. Not big on animal kingdom. They changed the pyramid, well, the right pyramid, and they flip it. And they want you to have fruits and vegetables and grains and carbs. And be careful with protein. Imagine, think about in medicine that here we are in 2024 and most medical doctors, here's what they know about nutrition. I'll just make a point about your kidneys. Protein's going to damage your kidneys. It's 2024. And still today, protein damages your kidneys. No, it doesn't. No, it doesn't. They still haven't got Nutrition 101, the basics. And this is why, guys, you could be confused. Every day, it seems, on our private Facebook group, or if I get an email to, you want to send an email, send it to info@martinclinic.com, okay? I want to, people accused me yesterday of not answering all the questions. I meant to. I must have missed a few. I didn't mean to miss, okay? Resend those questions so that I can look at them, okay? But it's unreal. Here we are, and, protein is bad, fat is bad, cholesterol is bad, moderation is good, fruits and vegetables are higher on the food chain than meat, eggs, meat, and cheese. That's not right. Nutritionally, it's not right. But they bought it. It's in their craw. And so their limited knowledge is killing us. I was reading an article. I'll bring you to diabetes as an example. I read an article yesterday, probably Sunday, I think. I read an article and showing, it was an article from 1917. A medical journal was here. I have it here. Let me just, I made a few, well, there wasn't really notes to be made, but I just wrote it down. Hold on a minute. Where did I put it? Don't mind me, guys. You know me. Oh, here it is. In 1917, diabetes was treated in 1917 by, listen to this, meat, organ meat, organ meat, and fish. They were telling diabetics in 1917, according to this article, to eat meat, organ meat, like liver and heart and, I don't know, tongue. Somebody said they like tongue. Fish, of course. Right? In 1917, 100 years later, how does modern medicine treat diabetes? Okay? Food-wise. Carbs, carbs, and more carbs. That's how they treat it. 1917, they had it right. Well, there was no insulin. There was no drug treatment for diabetes in 1917. So physicians were like my father, who in 1968 was diagnosed with diabetes and said to me, son, it's sugar diabetes. Yeah, Dad, what's that mean? Don't eat sugar. And all of that was lost. Because again, I'm bringing you back to why. Why did that get lost? Why in 1917? Big Pharma? Look, they did a wonderful thing. They discovered insulin. It's wonderful. I'm happy. Because of, you got type 1 diabetes. Insulin will save your life. Your pancreas isn't working. It's not that they don't do wonderful things. But just think of it. In 1917, eat meat. Okay? That was the treatment. Eat meat. Organ meat. Meat. Fish. Beautiful. That was the right thing to do. We're advanced 100 years and more, and because of big pharma and big food, it's carbs, and more carbs, and moderation. That's why we're confused. That's why we're confused. I'm not confused. I got trained properly. I told someone the other day, I had to get untrained in nutrition because I learned what everybody else learns in school. Okay? In order to get my nutritional degree, I had to toe the line. I knew it was wrong. I had to undo it. It's not that fruits and vegetables will kill you, okay? Please. Okay? But we live in a world where in 10 years, the average American, average Canadian consumes a ton of sugar. A ton. A ton is 2,000 pounds, isn't it? The average American and average Canadian in 10 years, and starting as children, will consume a ton of sugar. It's not moderation, guys. It's in everything. Big food. Big food really don't care about your health. And modern medicine doesn't know anything about food. They're stuck in the 70s. Okay? You ever see a guy with long sideburns and only sideburns? Okay? I had long sideburns. I did. I could show you pictures of me. Long sideburns. You know when? 1970s. We all wanted to be Elvis. So if you go to the mall and you see someone with long sideburns, you go, he's stuck in the 70s. Well, guys, that's medicine. They're stuck in the 70s. They're still blaming cholesterol for heart disease. They still want you to eat carbohydrates when you're a diabetic. And the teaching I give you guys on a daily basis is if you are a diabetic, not only are you on the Titanic, but you have an allergy to carbs. You and carbs don't get along. You might like them, but they don't like you. Carbs do not like a diabetic. Now, diabetics became a diabetic because they were carboholics. No exceptions to that. I'm not talking about type 1. I'm talking about type 2, adult onset sugar diabetes. They call it adult onset because it really only happens to adults, untrue. And we have a med for that. That's our modern system. Had nothing to do with prevention. If it was prevention, public service announcements would be out every day. You see the middle aisles of your grocery store? You see all those cereals there? And all that crappy dinner and that kind of stuff? Stay away from that stuff. That's what the public service, if they really wanted to save the healthcare system, that's costing us a fortune and is not delivering. Okay? Now I got to show you something else. Point number 4, because this is important too. Okay? Why are we in the situation? Big pharma, big food, modern medicine that does not take any nutrition hardly into account at all. See the 4th one? Media. Media. The media are bought and paid for. Remember now, the media are in business, guys. Okay? 80% of their budget, 80, comes from big pharma and big food. Do you think they're going to toe the line? Yeah. Big pharma and big food, they spend big time bucks on media. And what happens? Well, the media, they gotta, they're not going to bite the hand that feeds them. Right? They're not biting the hand that feeds them. And there's so few today investigative journalists. So I thank God for Facebook. I thank God that we have an alternative media here on social media that I can pontificate, at least give you the other side. $11,000 per person in the United States a year. Guys, you have no idea how much just the second someone is diagnosed in North America with diabetes, how much that costs. Crazy. Because if you're a diabetic, it's expensive. Not just the medication, the treatment from the eyes to the legs, the circulation, to kidney disease, to dialysis, to heart disease, to cancer. If you're a diabetic, you're 50% more likely to have a heart attack. That's common knowledge. And this is why even, you see, Big Pharma gets involved, because if someone becomes a diabetic, it's a cash cow. And then they do this. Well, they train physicians. They're not stupid. Well, if you're 50% more likely to have a heart attack, we better put diabetics on a statin drug. Guys, I get a migraine when I hear that. You know how many millions and millions of people are taking statin drugs? I said, why are you taking that? Well, I might have a heart attack. Yeah, you might. You're giving me one. But, let me tell you, for the last 70, 80 years, the thing that interests, I'm just going to make a statement, okay? And because I've been around a long time, so I want to make a statement, okay? You know what the number one topic that people like to listen to is? Health. Almost more than anything else. Health is at the top. Okay? Okay, now listen, I'm going to make a second part to the statement. And yet, people are very interested in health. But even today, if their doctor says it, must be true. And that's why things don't change. It's hard to change a leper's spots. Because, you go to your doctor and your doctor says, well, if you don't take this medication, you're going to have a heart attack. And you're a lay person. You don't have a medical degree. I don't want to have a heart attack, doc. I know you don't, but you better take this. Because that's how they're trained. And it just keeps going. Now, people today are much better in a way because they question. Not easy to question a physician. It's not. Because medicine's a big, we're not all medical doctors. It's not easy to question. But guys, I appreciate my audience because you guys question me all the time. And you guys are smart. Whenever I do my little tests, you guys always pass with flying colors. Okay? Okay. So, why? Why are we spending so much money? Why are we getting very little bang for the buck? Why? Big pharma, big food, modern medicine, media. Hard to fight that, guys. You know the old expression, hard to fight City Hall? Hard to get anything changed? Yeah, well, you just change yourself. Okay? I was talking to a pharmacist the other day. Smart. A pharmacist. Smart. And she understands the importance of food. It was refreshing to hear it. It can be done. Okay, guys. Now, I'm serious about those questions because some people ask your questions, guys, okay? And look, I try and not miss anything, but I guess I miss a few. I don't mean to. Guys, I appreciate the questions. I ain't scared of you asking me questions. I like, how are you going to find anything out if you don't ask, right? That's why we dedicate pretty well 2 programs a week to question and answers, okay? We're getting to that because we get so many. That's all right. That's all right. And a lot of stuff that I do comes from your questions, okay? Okay, guys. We love you dearly. We'll talk to you soon.